Everyone, I think we'll get started now. Welcome to our webinar on improving availability of reproductive health supplies in humanitarian settings. I'm Sarah Rich. I'm a senior advisor for sexual and reproductive health with the Women's Refugee Commission, and I'm also the co-chair of the Interagency Working Group for Reproductive Health in Crises sub-working group on supplies and logistics. This webinar is the second that we've held in conjunction between Reproductive Health Supplies Coalition and the Interagency Working Group on Reproductive Health in Crises. And I know that we likely have people on the line who come from each of those two communities that aren't super familiar with the other. So just to say quickly, RHSC is a partnership of public, private, and non-governmental organizations that works to ensure access to high quality and affordable reproductive health supplies in low and middle income countries. So it's really focused specifically on availability of reproductive health supplies. And IWAG is a coalition of UN, government, non-governmental research and donor agencies that aims to expand access to sexual and reproductive health services for people affected by crises. So it's really focused on humanitarian settings and people who have been displaced, including supplies, but not limited to supplies. So we're bringing these two groups together on this particular webinar with the aim of sharing some background and learning from the 10 plus years of experience that Reproductive Health Supplies Coalition and its members have had on improving data collection and data visibility and coordination mechanisms to improve access to contraception in low and middle income settings. The other aim of the webinar is really to think together about how we can build on the lessons learned from these 10 plus years of experience to apply them to humanitarian settings and to settings that have been affected by a crisis. And in particular, I think we want to be thinking about how these lessons can apply to settings that have been affected by crises over a longer term. So settings that either are facing a protracted crisis or settings that have faced a crisis and are now in recovery mode. So thinking specific, especially about those types of settings, as opposed to only thinking about humanitarian settings as the immediate onset of a crisis and then getting supplies where they need to go as quickly as possible. We have 4 panelists today, and I am excited to turn it over to them. The first is Maggie Murphy. She's a technical advisor with JSI. The second is Ellen Tomset. She's the global coordination manager with the Global Health Supply Chain Procurement and Supply Management. Then we have Alexis Heaton, who's a senior technical advisor with JSI. And last we have Sarah Coslin, who's a supply chain data and technology specialist with the Reproductive Health Supplies Coalition. So they will speak for around 45 minutes or so, and then we'll have a question and answer session at the end. You can raise questions in the questions box, and if they're for a specific speaker, please do put that person's name on the question. The recording and the presentations will be available online after the webinar, so anyone who wasn't able to join today will be able to listen in. Thank you, and with that, I'll turn it over to Maggie. Maggie, we can't hear you if you're speaking. Emily, I don't know, is there any chance that the organizing platform has muted Maggie?
Great, now I'm unmuted. Thank you, guys. Hi, this is Maggie Murphy. So I'm just going to do a quick overview of the presentation outline, and then we're going to jump right in since we have a lot of content to cover and really want to make sure we have time to answer questions. So I'm going to start us off with an introduction to the System Strengthening Working Group of the Reproductive Health Supplies Coalition, then give you all an overview of our history of increased data visibility over the 10 plus years we talk about in the title of this webinar, and then talk a little bit about the people who are the key actors in the work streams and the data policies we've put in place for sharing across these different actors. And then Ellen and Alexis will take over with a deep dive on some of the processes and technologies we use through these work streams of the System Strengthening Working Group, and then we'll touch on the key success factors and lessons learned that we think are relevant to both IWAG and just generally the community for thinking through how to implement a similar type of mechanism for other product areas. And then Sarah Coslin from the Reproductive Health Supplies Coalition will talk to us a little bit about our future vision for the Global Family Planning Visibility and Analytics Network pilot, and then we'll have time for discussion. So the System Strengthening Working Group aims to strengthen the global, regional, and country systems needed to ensure reliable and predictable reproductive health supplies and ensure that these systems are better aligned, more data-driven, and more coordinated. So this working group is under the Reproductive Health Supplies Coalition, and within this working group, there are two main work streams that we're going to talk about today. And so the graphic on this slide essentially indicates that we consider these two work streams to be part of a continuum of coordinated assistance to countries to improve family planning product availability. And on one spectrum, we have the short-term assistance. Don't worry too much about the acronym, we'll get into that later. But really this mechanism is focused on short-term responses to supply crises that have been flagged by countries. And then on the other spectrum, we have a more medium-term planning group that looks at the 6 to 15-month time period into the future in order to prevent supply crises from arising. And I think those of you on IWAG will see that we have a little bit of a different definition of emergency. I think on IWAG, you guys are looking at days and weeks of response to a crisis, whereas for us, given the way that the procurement mechanisms work for these types of commodities, we're looking more at short-term to us as more of a few months time frame, as opposed to a few days or a few weeks. I'm going to walk you through the history of increased data visibility. You know, we talked about 10 plus years, so here are our 10 plus years of increased data visibility. We started off in 2003 with increased visibility into firm orders and shipments of family planning products. And that visibility came with the launch of an online platform called the RH Interchange that collects data on contraceptive shipments and orders for over 140 countries and from the two main institutional procurers of family planning products, UNFPA and USAID, as well as some smaller procurers such as MSI, IPPF, and PSI. However, we realized that just seeing the orders and shipments wasn't really going to be able to help us understand whether countries were getting the supplies they needed when they needed them to avoid supply stock imbalances. And so we launched in 2007 a standardized reporting form called the Procurement Planning and Monitoring Report that Ellen will show you a little bit later to collect contraceptive supply data directly from countries. When this report was first launched, it was an access database that produced a PDF report that was sent via email to a limited list of partners. However, in 2012, we were able to get this data on an online platform and increase visibility and access to that data. So it is protected by username and password protections, but people who have access to the system can now see all of the historical data and have real-time access to data as it's finalized and published for the group of users in that community. And then around 2013, we wanted to have an opportunity to see full procurement visibility. So not just be able to see what are firm orders and shipments, but also what are some of the offers that manufacturers have. So an offer would be they've been informed of an order, but they don't yet have a firm purchase order for it. Another aspect of the full procurement visibility is getting visibility into procurers that do not report to the RH Interchange, such as ministries of health or other smaller procurers. And so in 2003, we got more of that visibility, procurement visibility, for a limited number of products when we started to get this data directly from manufacturers. And then around 2015, we wanted to do a proof of concept of bringing all of these data sources together into one platform to be able to provide a comprehensive picture for individual countries and individual products. And so we have this tool that brings all this data together for coordinated decision-making for partners at the global level. And Alexis will show you an example of the tool and discuss a little bit more how it works. And now we're in 2018, where we're working on the launch of the Global Family Planning Visibility and Analytics Network pilot that will build on this experience and work to provide more of an end-to-end visibility platform. So who are the actors involved in these work streams? So there are 2 work streams. There are the individuals who work in each of the work streams may be different. However, the organizations are the same. So at the global level, we have UNFPA, Commodity Security Branch in New York, and Procurement Services Branch in Copenhagen. We have USAID, and we have the Global Health Supply Chain Procurement and Supply Management Project, which is the supply chain contractor to USAID, and they execute all of the procurements of family planning products as well as other public health commodities on behalf of the US government, and they provide supply chain technical assistance to individual countries. We have John Snow Incorporated, JSI, and the Clinton Health Access Initiative, as well as the Reproductive Health Supplies Coalition. One of our key regional partners for these work streams is the West African Health Organization. They are the health arm of the 15-country Economic Community of West African States, and they have funding to procure family planning products for a limited number of countries in that community. So it was really important to bring them into this global level work and strengthen that coordination between WAHO, UNFPA, USAID, and other partners working to improve FP product availability at the global level. And then at the country level, one of our most important actors is the Ministry of Health. A lot of the ministries of health are directly reporting their contraceptive stock level data through this standardized report, the PPMR. And in some cases, it's the logistics officer or another person in the ministry whose job it is to manage the family planning products on a day-to-day basis. We also have UNFPA country offices and USAID missions, who are both key supporters of this work in the country, as well as key points of contact for the global level partners to follow up on issues that countries may flag in those countries. We also have the Global Health Supply Chain Procurement and Supply Management field offices that provide that supply chain TA, and as well in some circumstances may report the contraceptive stock level data on behalf of the Ministry of Health. And then we have non-governmental organizations such as MSI, IPPF, and PSI, who may report data for the programs that they support in certain countries to this standardized reporting platform. And then we have some key supporters at the global level, such as the Bill and Melinda Gates Foundation, DFID, and FP 2020. For data sharing policies, as I just described in the previous slide, we have a lot of different organizations that are working to share data across organizations to have the same picture of what's going on in each individual country. And so within these work streams, the data sharing policies vary from very formal, such as having non-disclosure agreements with manufacturers, to just general principles that have been established as part of the terms of reference of the work stream. For the broader community, each online data platform, the Procurement Planning and Monitoring Report, and the RH Interchange for shipment tracking have its own requirements for gaining access. And access to the detailed data requires a verified username and password. However, the requirements for gaining a username and password are not the same on each platform. So with that introduction, I'm going to turn it over to Ellen to start the deep dive on the processes and technology.
Thank you very much, Maggie. That was a great introduction. I'm going to talk about specifically how we collect country data through the PPMR, and then looking at the sort of right hand of that spectrum that Maggie showed earlier to talk about how we coordinate to address unexpected supply crises. So the Procurement Planning and Monitoring Report, or PPMR, it's currently managed by the Global Health Supply Chain Procurement Supply Management Project. It captures information on contraceptive stock and shipment statuses and other contraceptive security issues from family planning programs. The PPMR is updated monthly or quarterly, depending on the program. That often depends on when countries actually have stock data available to share. It primarily reflects the stock situation at the central level warehouse, although some programs do report for multiple levels on the supply chain. And what the PPMR does is it provides an opportunity for individual programs in each country to communicate requests for urgent action to global level partners. So when we talk about programs, you know, as Maggie mentioned, it could be the Ministry of Health and reporting their stock levels, or it could be an NGO such as Maury Stopes International or Population Services International reporting their stock levels. And so they have an opportunity through this platform to communicate to the global level partners. They can ask to expedite existing orders, to delay or cancel existing orders, create new orders, or to request support with transferring overstock products to another country. So let's look at, what exactly are they reporting? So here, this slide shows a line from a report from a particular program. So in this case, as you can see, it's the Ministry of Health reporting. So the product here is the copper T IUD. And there's a number of data points. So so first of all, let's look at the quantity on hand. So they've got 9,390 IUDs on hand, and their AMC, or their average monthly consumption, is 850 IUDs. So from that, you can calculate the total months of, or forecast the total months of stock that they have on hand. And so the MOS, or months of stock, you can see is 11, and that's essentially 9,000 divided by 850. And so they've got 11 months of stock, which is a fairly, good amount. And you can see in their comment that they've said, we have an adequate stock level. We are expecting for the year 2018 an additional 15,500 units from UNFPA. So they seem like they're in, in a pretty good situation here, and therefore there's no CARS action recommended, and we'll talk about that in a minute. So they're not asking for help from the global partners in this particular report. Currently, we have 38 countries reporting and 60 programs, so it's quite comprehensive. So that's the data, and that's what we're using in driving our decision making and coordination. And so in the first instance, we'll talk about the Coordinated Assistance for Reproductive Health Supplies group, or the CARS. Now, the CARS was formed in 2004 to respond to imminent family planning commodity stock imbalances. So stockouts, shortages, overstocks that are projected to occur in the next 0 to 6 months. So you can see we're looking at kind of the short-term time frame. The PPMR was a tool that was created to support the work of this group. And the CARS relies on the requests for action that are communicated by the countries or programs via the PPMR to populate its agenda. So as you saw before, the country did not ask for help for their IUDs. Therefore, that particular line would not appear on our agenda. However, so the CARS group meets monthly then to review these requests, decide on actions, and to respond to the country requests as possible. And the RHSC is a facilitator of this group. So now let's take a look at what exactly that coordination looks like through 2 examples. So in example 1, we see in September 2016, country A has reported a significant overstock and requests help to transfer. So then in October 2016, after some discussions through the CARS, the UNFPA agrees that because this is UNFPA donated product, they have agreed that this product can be transferred. And in the meantime, this is a West African country. And so WAHO steps in to agree, yes, we will fund transportation for this transfer. So then a process goes on to identify a country to receive the transfer. And in January 2017, country B, which had been identified to receive the transfer, falls through. So, it's a process to get these countries to agree to receive this product. And in this instance, that country falls through. So in February 2017, country C is identified as having a shortage of product and wants to receive the transfer. So okay, great, country C is ready to go. And so there's still a process that we go through to have this country formally note that they will receive that they're willing to receive the transfer. We're working through 2 ministries of health on the countries, and then working with UNFPA because it's their product, and then obviously WAHO goes through a process to arrange for the transport. It's put on a plane or a ship, and it ends up July 2017. Country 2017 finally receives the transferred products. So you can see in this example that a number of different organizations are involved in this coordination. It's a very sort of high intensity, high touch kind of activity. So in the second example, November 2017, Country X reports they're projecting a stock out of combined oral contraceptives in 6 months. And they request support for a new order as they have no order underway. So this puts in place a process for going back to the global procurers, UNAID and UNFPA, to see who might have money and who might be willing to provide funding to support an emergency order for this country. And so as you can see, in March 2018, USAID agrees to provide $15,000 in emergency funding support. And so, all right, so you've got the funding in place. There's still a procurement process that needs to take place. We get the product from the manufacturer, we put it on a ship, and in June 2018, Country X is expected to receive the new order. So as you can see, data is really foundational to driving the decision making in these 2 examples. If we didn't know the stock levels, if we didn't have the ability to communicate with these countries, we wouldn't be able to take the action that we were able to take. And then also, it requires significant coordination across multiple organizations in these cases to address these immediate needs. And so with that, I'm going to turn it over to Alexis to look at a medium-term solution.
Great, thanks, Ellen. Yes, so my name is Alexis Heaton. I work for JSI, and for the past 4 years or so, I've been working with the Coordinated Supply Planning Group, which is a work stream of the Systems Strengthening Working Group under RHSC. And following on the experience and the success from the CARS group, it became clear that the same data that was used by CARS, so the country stock levels and consumption trends that Ellen described, combined with information on firm and planned shipments from some of the data sources that Maggie had described earlier, could be used to look further into the future to proactively monitor stock levels and try to prevent stock imbalances before they become emergency issues for countries. So really trying to prevent things from becoming CARS issues. And this was the start of the Coordinated Supply Planning Group, otherwise referred to as CSP. And in 2012, a similar group of members to those involved in the CARS group started to meet and discuss this idea. And in 2013, the group began to meet more regularly to really flesh out the purpose and membership of the group. And then in 2014, in recognition that the group needed some dedicated resources to put into place processes and tools to support this idea, JSI started playing the role of facilitating this group. And the current membership includes USAID, UNFPA, CHI, the GHSC PSM project, JSI, and the Reproductive Health Supplies Coalition. So what we do is CSP is focused on processes for 3 key activities to prevent stock imbalances and ensure the more efficient allocation of resources among countries and donors. So we have a monthly country review process and monthly meetings where we discuss the review and validation of country orders that have been submitted to the donors, the two main donors and procurers that we support, that is UNFPA and USAID. This helps ensure that we're avoiding duplication, avoiding overstocks, and identifying areas for resource optimization among the two donors. We're also monitoring country stock outlooks for countries to flag risks, looking beyond what the 0 to 6 month the CARS focuses on, but the 6 to 15 month, or what we call the medium term time frame, to make recommendations for where we see stock imbalances that we think CSP members could help address. And then we also spend time reallocating or moving shipments when demand that we are seeing from countries is exceeding what a manufacturer can supply, to prioritize countries that have the most urgent needs first. So moving shipments around for that. The second main activity that we do is the funding gap analysis, where we're identifying countries that need shipments in the coming year, but can't place them due to a lack of funding, and then using this information and analysis for resource mobilization. And then lastly, we've been a little more so recently working with trying to provide the suppliers that we work with better forecasts and visibility to expected future demand for this product. And this is a work in progress and something that we're trying to build out a little bit. We also just function as sort of an ad hoc resource if questions come up related to family planning supplies that either of these donors support. So that's a little bit of background. And then on the next slide, so just to talk a little bit more about our processes and technology and how we ensure medium-term supply availability. We've basically been working for the past 4 or 5 years to establish our processes, and been supported by people across all of the member organizations to really put in place data sharing agreements and management policies to help facilitate how we work together, and then later a focus on technology, which I'll talk about. So we first developed terms of reference to help formalize the group, received organizational commitments to ensure that there was a routine participation from all of the members, support resources in terms of having dedicated people to this group. And then we also purposefully set it up as a forum and membership that allows the group to be responsive to changing needs, because sometimes, you know, what we set out to do when we sat together for the first time to formalize ourselves in 2014 has changed slightly in response to what has been identified as needs that this group could help address. So currently we focus on 4 family planning products for our country monitoring, and we look at data for 48 countries. The choice of products is based mostly on data availability. So as Maggie had mentioned earlier, we receive shipment data directly from a few key manufacturers. And we've also been looking at products where the demand has been exceeding the supply. And that's really driven what we've focused on so far. And then we also look at countries where there's data from either the PPMR data system in terms of stock levels, or where we have supply plans from countries, and ideally where we have both. So we currently have people assigned to monitor specific countries. So there's continuity ensured from month to month. It means that people can become familiar with a specific country, understand the context, know the history, and often that's based on where people had previous work experience or relationships, so that sort of their ability to navigate the relationships and getting follow-up information has been assisted through that process. On the technology side, we started with Excel. So our early meetings involved many people looking at the same data, but in different spreadsheets and their own way of organizing them. But there was really almost immediate recognition that we needed something that could be regularly updated and shared across membership organizations, so that we had a common view of the data to support analysis and decision making. So our first step was to create an Excel prototype that brought all of this information together. And this really helped us understand how we needed to see the data and be able to map the data coming in from different systems, because as you can imagine, you know, what one group was calling products did not match what another group was calling the same product. and getting those to map together was a really tedious exercise, but it was very worthwhile to go through because we learned a lot through that and how things needed to map so that they could be harmonized and come together in a comprehensive picture. Then in 2015, with support from the Reproductive Health Supplies Coalition, we transitioned this Excel prototype to an online tool that had automated data feeds, and then which is what this snapshot pictured here represents. And I just want to talk through this graphic quickly because it's a really powerful tool that we have for visualization that I think has informed a lot of how we work together, because just having a single visual can explain a lot to countries where putting all of the data in an email may not. So just to quickly talk through what this shows, if you see the gray bar across the center, that's showing what a country has indicated as their appropriate inventory levels. It's measured in months of stock, which is on the right-hand axis. So really what you want stock levels to be within that gray bar running across the middle. And then the dark gray line that goes up and down throughout it is coming from data from PPMR, and that represents months of stock for an individual product. So how many months of stock do they have? How much do they want to have? And then the orange line is the consumption levels. Again, this is coming from the country data from PPMR, so how much each month they've consumed. And when both the gray and the orange bar turn from solid to dotted, it's then taking what the current data is and forecasting it into the future. Then the vertical bars are the shipments in quantity, and they're color-coded by procurer. So you can see the red here is meant to be a UNFPA order, and the purple is from another source that is not either UNFPA or USAID, but we have visibility too. And then looking at that gray line, as you can see, somewhere around January 2019, we could start to anticipate a shortage where the country is going below their ideal minimum months of stock. And then by about June 2019, we would expect there would be a stock out if their consumption continues at that forecasted rate. And so what we can do with this tool is then use it to create scenarios of saying, okay, well, if it looks like then they'll need the shipment to arrive by October 2018, and then use this to create scenarios, play with different numbers, quantities to see when exactly they need something to arrive and when then their next shipment needs to be planned, and then share that as a recommendation with either partners within the CSP group, with ministries of health, and just to inform decision making. Often we might hear from a ministry of health, if we see something like this, they say, yes, but actually our consumption has gone way down, so we're fine, we don't need a shipment. But it's really just to inform that analysis and inform that discussion. And then per our data sharing policies, this tool is available only right now to current members and authorized users due to some of the confidential nature of some of the data we receive from the manufacturers. So, and now just to give you a little bit more of a detail of what we actually do with this data and some of the key activities from the first slide. The first example is one of our funding gap analysis and looking at resource mobilization efforts. So in March 2017, we were working with country A. We had their supply plan. We were looking at all of the confirmed shipments for the year and estimated with them that they would have a $5 million gap for family planning products for the balance of 2017. We work with them to get that data vetted, agree that it matches their numbers, get the Ministry of Health to agree that we can share this information with partners, and then start sharing it with UNFPA, USAID, FP 2020, and other partners. Then, this takes a fair amount of back and forth. There's a lot of banging on doors to see what other funding might be available. Are we sure the government doesn't have additional funding that they're going to put in? Are there other sources of funding that might be available? So that takes some time. And then when it becomes clear that there really is no other source of funding, UNFPA and USAID agreed to mobilize another $1.9 million in additional funding so that we could avoid stockouts. So there might still be shortages given the size of that gap, but they were able to provide sort of the funding needed to avoid stockouts for additional products. And then, because it takes a while then to actually turn those into orders and get them shipped and have them arrive in country, those new shipments were received in country A by around March 2018. The second example is looking more at our routine monitoring and taking action to avoid a stock imbalance. So in this scenario, as part of our routine monitoring and someone is assigned to look at country B month after month, we flagged that there was a USAID order that was expected to arrive in May 2017, but if it arrives then, it would exacerbate an already existing overstock situation. So sort of started, waving our hands and saying, hey, this shipment's not needed. What can we do to confirm that it's not needed? And then ideally get it canceled. So USAID then went back and conferred with their mission in country B that this order was not needed. The order was canceled, and then that saved approximately $590,000. So those are just two examples of how we share information, flag things in that medium term, and then make adjustments to orders or try to find funding for orders that are needed. So, just in thinking about how this type of coordination may be useful to other groups, I just wanted to talk a little bit about what some of the key success factors have been. I think the first is, a very clear recognition that coordination is not a free good. Coordination needs to be deliberate, and there needs to be organizational commitment to it. So we've been very fortunate that UNFPA and USAID have remained committed to this. We have, partners who have continued to provide support to this group, doing a lot of the analytics and technical support roles that really enable this group to function and be achieve the types of outcomes that we're looking for. I think having a home within the Reproductive Health Supplies Coalition has been very helpful. It's given us, our backbone and making sure it's clear that this is something, work that is supported by the coalition, and trying to increase our participation and engagement with other types of groups and members within the coalition. Another really important part has been our partnership with ministries of health and having a strong commitment to respecting their data and decision making. As a general rule, CSP only makes recommendations. We don't make decisions. We take our recommendations and give them back to donors who then engage with ministries, or when we are talking to ministries, really just saying, this is what our data shows us. Do you have different data? And similarly, as you'll see from all of the examples, when we refer to them as country A or country B, it's also really respecting the fact that this is, we're not out to air people's dirty laundry. We're just working and trying to all achieve a common goal of supply security. Another important factor has been the continuity with the country reviewers. So having people who are specifically assigned to countries so that they can really follow issues from month to month and over time and be familiar with a specific country situation. We've also been very deliberate in having SOPs and ongoing organizational commitment to ensure that there is continuity if there's turnover and participation. We've certainly had changes in members, but having clear processes in place has made it much easier in terms of onboarding new staff when they come on and pick up for someone who is leaving because of a change of job. And then lastly, I think the open data sharing and dialogue as well as trust has been really important. And I know that the trust part is really fuzzy, but I think the fact that the members within CSP have been really focused on the collective goal rather than individual goals have really helped foster this success and making sure that, when we come together and talk about issues, people are talking about them openly and in an environment where we're all trying to do the same thing. So there's no tension and people do generally trust when they share information that it'll be used constructively. And through this, we've, just to give you a sense of what we've done in 2017, we were able to help place an additional $12.4 million worth of orders for 14 countries across 10 products. We helped donors save $1.8 million by recommending canceling or reducing orders that were not needed. And then we did recommend delaying orders to prevent potential overstocks worth over $1 million. So, it's a lot of work and a lot of time of people coming together, but we do like to sort of measure our success so we're able to help demonstrate the value of how we work together. Lessons learned, we started out building as we went with the tools we had. There really was not necessarily a guiding strategic vision, which has been okay, but if I was thinking about starting this over, I would definitely recommend starting with more of a strategy and designing more deliberately from the outset. The next point is on scope and defining what is possible now versus the ideal. I think, most of our data that we have currently only allows our assessment of stock levels into the national or central level of countries. Ideally, we'd be able to see, down to service delivery points. But at this point, we can really only help to ensure that there are enough products available nationally, and then assume that others are working to ensure that they're distributed appropriately. Another big lesson is that our first tools, Excel was okay. And as I mentioned earlier, I actually think it was really helpful to start low tech because it helped us iterate and think about how we really wanted to see our data, how it came together, and being able to identify the challenges with data harmonization across systems. We were able to work a lot of this out before we engaged a more high-tech solution. So when it came time to look at other technology, we already knew what we wanted and we'd already identified some of the key challenges with the data. And then while we do have some dedicated human resources, our current data systems still require a lot of triangulation and manual work. It's a real limitation in terms of time and resources to look at the data, and that's what's hindered our ability to move on to other products. So I do think, if I was planning to do this, it's just really being careful about matching the scope of what you're trying to achieve with the available resources. And then as we look to the future and knowing, we really would like one platform that brings data together in a meaningful way. Even before we jump into that, we have been taking the time to really inventory our current constraints, examine how we work together, and given this long history of CSP and CARS, thinking strategically about how we could be better aligned into the future. And I think getting into the global family planning van, which Sarah Coslin will talk about, and we're all very excited for. So over to you, Sarah.
Oh, okay. Thank you, Alexis. So I'm Sarah Coslin. I'm one half of the management unit of the Global Family Planning Visibility and Analytics Network, or you might hear it called Global FP Van or GFP Van in the future and in this presentation. So what is the Global FP Van? So we are looking for the Global FP Van to be a virtual collaborative space where teams use the same data to make supply chain decisions. The term van has sort of been adopted by the public sector. In the private sector, you might hear the same concept being called a control tower. So if you're looking for the future or would like to get online and Google, control tower is sort of the private sector terminology for it. So the idea is we want our global stakeholders, countries, and supplier teams to be able to simultaneously look at the same data to make decisions together. In this case, supply chain decisions about the purchase and delivery of commodities, family planning commodities. It's this idea of data in the global FP van that allow us to see where products are in the supply chain, make decisions together on product flow, and ultimately ensure continuous availability at the country level. Because after all, you can only manage what you can see. Leadership in the health and supply chain community asked the RHSC to take the lead in hosting and managing a global van as an exemplar for the rest of the health community. As you can see in the presentations before, the RHSC has taken the lead previously to help build these tools with the rest of the community that were precursors to the global van. We've put in place a steering committee made up of UNFPA, USAID, DFID, Bill and Melinda Gates Foundation, and a non-voting user representative, which is actually Alexis Heaton. And we're gearing up to launch this work presently. Next slide, Maggie. Thank you. The global FP van is not recreating the wheel, but rather building on the assets our community already has in place through the groups and tools described by Maggie, Ellen, and Alexis previously, in order to be more in line with the industry standards. The global FP van is the migration onto a more advanced, flexible, virtual collaborative platform with analytics engines that allow end-to-end supply chain data integration. However, it's not just a technology solution. It's a technology platform that's going to improve upon existing data and allow people to simultaneously see the same data, thus helping contribute to shared decision-making policies. As we transition to new technology platform, we'll gain improved efficiency and effectiveness in how people work together and use this data to make decisions, which is expected to optimize the delivery of processes. So we sort of have 4 pillars that we're looking at for implementation: people, process, policy, and technology. So I'm going to walk you through a little bit about each of them. For people, the global FP van needs a collaborative network of supply chain professionals whose interaction is governed by a set of roles and responsibilities. There needs to be providers, analysts, and users of data along with the supply chain decision makers. As discussed earlier in these presentations, the RH community through CSP, CARS, and PPMR, we have groups of professionals already in place across the procurers, shippers, manufacturers, countries, and data analysts. RHSC is built on this foundation and has put in place central governance structure to support this collective action. Our governance structure includes a multi-partner steering committee that meets every 2 weeks to align policies made up of the previously mentioned organizations. They work to align the policies, the design needs, and funding options. There's also a central management unit made up of myself and Julia White, who's the director of the Global FP Van with RHSC, and we oversee the implementation. And we have 4 task forces that provide technical input for the design and implementation. This is really key to talking through what the community work has been doing and what we want it to look like, and bring everyone that is users along the journey with us. If we look at processes, the global van needs procedures and processes that define how people interact and make supply chain decisions. Once again, through CSP and CARS efforts, the RH community already has in place many of these procedures, processes, and norms. Through process mapping, we identified operational efficiencies and are looking at ways to better merge and align the work of these 2 groups. In addition, the global supply chain players, manufacturers, and countries will all be on the same platform designed to increase visibility between relevant partners for more collaborative decision-making. Having all of these players, including the manufacturers and countries, on one platform is not something that the community has done before. In regards to policy, we have so many processes and people at work that there needs to be a common understanding among key players as to how the global FP van operates and the obligations of each of those operations. What we will focus on is data sharing elements, agreements across multiple data providers, the donors, the countries, the manufacturers, and what currently is the CARS and CSP groups, as well as coordinated systems for data governance and master data management. Alexis touched on this a little bit in her presentation with who they're able to share certain data with the CSP. So we're looking to sort of revolutionize those agreements with the Global Family Planning Van. We have currently a data sharing task force that works on discussions with manufacturers and the countries, helping them bring along the value of a multilateral data sharing agreement that hinges on a robust, secure, role-based data security model. And lastly, technology. An important aspect of the Global FP Van is a data hub with a virtual collaborative platform that will allow the different players to see the same data and execute supply chain decisions. Over 10 years, our community has put in place important visibility tools like the ones you've heard about today. but their siloed and outdated technology has led to inefficiencies around data cleaning and triangulating. What our community currently continues to lack is a supportive technology that allows groups like CSP and CARS to see the same data and execute supply decisions in a more streamlined manner, saving both time and effort. Since September last year, community members in the global FPVAN task forces and steering committees have worked together with vendors to develop an agreed upon set of business and IT requirements that were then used to pull together an RFP or request for proposal process to select an IT solution capable of offering the flexibility, interoperability, and sustainability to grow and expand over time to connect with different data visibility systems, both upstream and downstream. We've been going through the selection process and are looking forward in the coming weeks to being able to make a public announcement about our selection. So what does our pilot scope look like? Maggie, if you could head to the next tab. Thank you. So we had to start, you could start with a large scope or a smaller scope. And to be successful, we thought we really should hone in on a very specific scope to get this right the first time. So our pilot is going to last a year. We've been kicking off, like I mentioned, selecting a vendor, and we'll be announcing that soon. And then we've selected 2 countries. So the steering committee participated in a robust selection and ended up choosing Malawi and Nigeria as our pilot countries. And we're going to cover only 2 family planning product categories, oral contraceptives and implants. Along with what those family planning products are, we selected 4 manufacturers that cover production of those: Bayer, Mylan, Merck, and Shanghai Dawa. And you can see below there our partners, some of which I've mentioned before, some of which are on this call, and include the Ministry of Health and manufacturers, are all participating as members of the steering committee and the task forces. The scope has been fixed for us, and we look forward to expanding once we've completed the pilot. Our scope is also looking at data from the procurement and manufacturers down to the central medical store. The central medical stores is where our data will stop, and in-country van efforts pick up. We're not looking to change in-country efforts, but hope to align with any in-country work to provide a whole picture where possible of aggregated inventory levels of the entire country. So this is where we have actually, if you, maybe we can email out at the end of this, we have a website with a video that I would love to have shared, but for time's sake, we're not. And you can sort of see the vision and where the Global Family Planning Van looks to stop and align with in-country efforts that go down to the last mile. Next slide, please. So looking to the future, the Global FP Van is expected to transform the work that you've heard about here today for CSP and CARS and key players along the supply chain, including the procurers, manufacturers, freight forwarders, and the country logistics management teams, through increased visibility by all parties and opportunities for modified interactions and processes. Some relevant anticipated advances and how it should lead to impact. We're looking at improved end-to-end and simultaneous visibility for key players on the supply chain to answer their key questions. This initiative is really about helping these key players answer questions they've been asking for years. Procurers want to know how to prioritize what to buy for who. Manufacturers want to know what to produce when. Freight forwarders want to know what to ship by when, and countries wanting to know where their products, when their products will arrive and how much they should order. The visibility and interaction on the collaborative platform will help all of these players be more informed in answering their key questions and will allow more time for CSP and CARS to focus on analysis and making recommendations on coordinated supply planning and coordinated exception-based management. There will be a key focus on countries, especially regarding visibility to inbound shipments, and a focus on manufacturers providing them inbound improved visibility to donor and country data that will enable manufacturers to identify demand trends and make better operational plans for the community. For all involved, the idea is to reduce manual data flow and overlap in data management. These efficiencies allow the CARS group and CSP group to cover more countries and products, meaning success like those achieved for implants could be replicated for other products and health areas, leading to more timely and cost-effective delivery of commodities to countries.
Thank you so much to all of you. I think we just have a few minutes and we do have some questions that have come up. I'll start with one on data quality. So obviously having greater visibility into data at the country level is only useful if that data is high quality. I was wondering if there have been any instances in which you were concerned about the quality of the data that had been collected and what was done to address that, or if there's any kind of technical assistance that is provided in those cases.
Hi, this is Maggie. Sarah, sorry, I can take that question. I think, so there are sort of two processes. There's the country data reporting, the PPMR processes, and then there's also some of the data that CSP uses in terms of the country supply plans that we get directly from countries. On the PPMR side, there is a process built in where the individuals who are communicating directly with the countries to collect the data do a very comprehensive review of the data as it comes in, flag any problems, and have that back-to-back that back and forth feedback with the country. If they don't feel that they can get that data to a point where it makes a lot of sense and is not really reliable for decision making, then they don't publish the data on the platform to other users such as the CARS group. On the CSP side, we also receive, country supply plans directly from countries and other partners, and we do an evaluation of the supply plan. And if we feel that there are significant methodological challenges with how they forecasted demand or how they plan their shipments, then we often do follow up either directly with the partner who provided it or via UNFPA and USAID, who are present in those countries and supporting implementing partners to assist the countries with the forecasting and supply planning to make sure they're aware of the issues we've seen and that they can be remedied. But we try our best to not be making very important decisions off of data where we think there are perhaps quality issues.
Great, thanks. Here's another question. I think this will be our last question. Do you monitor family planning stock levels for countries experiencing humanitarian crises with significant displaced population? How do you support country governments to ensure continued supply of FP products?
So this is Maggie. I can take that one again too. I think, since both Ellen, Alexis, and Sarah mentioned that we are mainly looking at that first kilometer of the supply chain. So we're really looking at the national level stock situation, and we don't necessarily have a lot of visibility into countries who may have humanitarian crises or refugee situations in particular parts of their country. We don't really have that visibility. I think in terms of countries that are experiencing humanitarian crises at more of a sort of country level, we don't do a lot of work with those countries, and I think it's really around the data visibility piece. And so we don't necessarily have the data visibility, so we can't necessarily do the type of work we do for the other countries where we have that visibility.
Great, thanks. I think that is all the time we have. One person did ask, will these presentations be made available online afterwards? And the answer to that one is yes. But we do have several other questions in the queue, and we will do our best to write out answers that we can share with all of you. Thank you so much to the presenters for sharing this really valuable information, and to all of you for joining the webinar. I hope we can continue the conversation about how we can apply these lessons to humanitarian settings, given what we know about how it's worked in low-income settings in the past through RHSC mechanisms over the past 10 years. Thank you again.